Welcome to another episode of Under Your Skin with me, Dr. T. Today I have a very special guest, one of the most fun dermatologists around, Dr. Agni Kumar Bose.
Hello, hi.
He is one male dermat in this sea of women of dermatologists. How does it feel, Agni?
Hi, thank you for having me. How does it feel to be on your podcast, or how does it feel being a
Both.
male dermat?
Both. I'm sure it feels great to be on my podcast. Better.
It feels amazing to be on your podcast. No, thank you for having me. As for your second question, I sometimes miss having boys around, with whom I can crack some jokes or whatever.
You can crack jokes with us.
Of course, I can crack jokes with you.
You do.
I know we do, but you know what I mean. Yes, dermatology is completely, for the longest time, been dominated by women. You must have, even during your MD, you would have, how many boys were there?
I feel it's a shift. I mean, all of my professors, they were all men.
Okay.
Back in the day. And I think maybe the shift has happened more recently, but now it's all girls. We had one guy and we were 6 girls.
Yeah, usually that's how it is, right? Yeah. But when I was doing MD, we still had 3 plus 3, so three boys and 3 girls. But yes, when you enter practice, there are very, very few male dermatologists. So sometimes it feels weird from the perspective when patients discriminate against you. And it's no fault of theirs, right? Like each person has their own preferences. You might feel more comfortable with a male gynecologist or a female gynecologist or vice versa. Similarly, because majority of our patients are women, I would say almost 80 to 90%.
Absolutely.
Of our patients are women. So, and wo rakha hai, they've outrightly,
especially in private practice.
In private practice, sometimes they've outrightly come and told the receptionist that, no, I don't want a male doctor, I want a female doctor. So sometimes you do feel bad that, am I any less skilled?
I'm kind of finding this great because, finally men face some discrimination somewhere. I love it.
Reverse sexism.
This is great. What a great moment.
What a great moment. There was that hashtag, women in men-dominated fields.
Yes.
Mera ulta hai.
Yeah.
Man in a woman-dominated field. So it's okay. I mean, I hold nothing against the patient. It's their personal choice. Yeah. But
I feel the entire world of medicine does have a lot of these pre-existing sexist biases. Like ortho mein there are no women. Very few women.
Yeah.
One of my very good friends was doing ortho residency, and my God, she was discriminated against like nobody's business. Like she had to go over and above to prove herself, to say that, hey, I'm strong enough to pull somebody's, femur.
Yeah.
Or even just, strength aside, she was absolutely strong enough to pull somebody's femur, no doubt about that. But even just to prove her knowledge, she had to, talking of generalizations, most orthopedists are just chilling and enjoying their life. And she had to go over and above to prove that, okay, I know my theory. When the guys didn't have to bother about that. So
yeah, luckily I don't have to face that discrimination. But just because majority of our patients are women.
Yeah.
So hota hai.
That is true.
It is what it is.
Throughout MBBS, I remember, in a government hospital doing internship, especially during internship, we were walking in the wards, we were doing all our blood collections and our daily rounds, and all the patients would call us sister.
Yeah.
The girls would be called sister and the boys would be called doctor. And I thought it's just a government hospital. Intern or doc saab, something of that sort.
Intern.
But we were sister.
Yeah.
And we were like, yaar, abhi to ho gaya, exam bhi ho gaya, yaar. Like, there's nothing against the profession of nursing, like, all respect to them. But what is this generalization that I can't be a doctor? And last week, I tell you, my own son, he's 5 years old, and he comes and tells me, Mama, you are actually not a doctor, no? You must be a nurse. I said, why? And he's like, because girls are nurses and boys are doctors. And I was like, one chopper I will give you if you say one more
So
word.
you must have thought that your husband, he's the doctor and you're the nurse.
Yeah, because I feel like society shows them, like in their storybooks, there's always a picture of a girl nurse and a boy doctor. Like an older male doctor and a young female nurse. This generalization is ingrained. All storybooks, every comic book, every movie, that's always a generalization.
Because
I hope
there's not so much age difference that doesn't have to be there. Okay.
Yeah, but that aside, it was. Wait, what was I going to say? I didn't expect that. I shouldn't have said the older male. Oh God. Okay. Yeah, also my parents were both gynecs. And patients, they work together. And patients would always assume that my dad's the one operating and my mom is just there to sit and explain the medication to them.
And it's it's funny, right? Because gynecology one would assume that it's a women-oriented field.
No, but the surgical part of it, a man has to do, no? It's some weird level of sexism. And my mom would be like, we have the same degrees. My mom got a gold medal, which my dad was great, but
No, I know.
yeah, like, come on. So yeah, we live in a very sexist world.
Interesting.
Moving on to sexism in the rest of society, moving on to sexism in skincare. What do you think about men doing skincare? Are men doing it? What's holding them back? What's happening there?
Not as many men are doing skincare as women are doing, because I feel culturally, you would have always seen probably your mother or your sister while growing up use any sort of skincare products. And you would have probably seen your father just use a shaving foam. I mean, that was the only cosmetic item that, your father ever owned. So because while growing up, they've always associated taking care of the skin as more of a feminine thing, probably is the reason why not many men are into skincare. But I'm so glad that people are now breaking, apart from that, and realizing that skin ka koi gender nahi hota. Skin is, I have the same skin that you have, you know what I mean? So men are entering more and more into skincare. Sometimes jokingly, I feel that maybe their girlfriends or their wives or their sisters force them कि कुछ लगा ले, तुम सिर्फ साबुन से ही चेहरा धोते हो, and they'll have say 5-6 different products, and this boy would probably have one shampoo which he uses as a face wash, which he uses as a body wash. I used to do that for the long time.
Yeah, my husband literally does it. We have all these fancy shampoos and conditioners in our bathroom, and he uses this one standard, like, huge bottle of shampoo, which he uses for his head, face, neck, shoulder, body, everything, same shampoo.
I used to do that.
And he swears by it.
Yeah.
It's ridiculous. It's honestly very infuriating, because at the end of it, his skin is still
Yes.
But that's just genetics. He was just blessed. So,
no, but men, I think we need to research this properly, because this is just a hypothesis in my head. But we age better than women, And no, but
I do not at all agree. I see so many men, by the time they reach their 50s or 60s, they start looking like their wives' dads. Have you seen that?
Are you one second. But no, I'll tell you why. Because so the beard, okay, this is a natural sunscreen in a way, right? If you ever go bald and if you look at the skin over your scalp, it's like a baby skin, right? And if you look at a bald person, if you look at their skin on the scalp, it's just like any other facial skin. So that's the amount of sun protection that the beard offers. And if your husband ever shaves, bacha lagega, right? So one naturally, whether or not we keep a beard, the melanin, which is such densely stipulates, it's situated here, it acts like a natural sunscreen, number one. Number two, also men tend to have oilier skin. So our skin barrier intrinsically is better hydrated. Yes, that also leads to open pores in the future because all that sebaceous activity, but at least we age better. And within the same ethnic race, men have a higher density of melanosomes as compared to women of that particular race, which again is your natural sunscreen. So I just feel biologically we need to prove it, like, proper एक study करके दिखाना पड़ेगा. But this is just my theory, it's my hypothesis that men age better than
women. They definitely do biologically. Yeah. I just feel with societal conditioning and the lack of skincare, I think that's where the massive shift happens.
Fair enough. So again, a lot of confounding factors here, because traditionally the man has always stepped out.
So he's had more sun exposure.
Traditionally. Like I know this is a very overgeneralization, but maybe that could be that he's more exposed to ultraviolet radiation.
But in today's day and age, where men and women are both stepping out equally, and women are stepping out with sunscreen and men are stepping out without sunscreen,
fair.
I really feel some sort of difference is starting to happen.
Yes.
But in saying that, I've noticed a lot of guys coming to my OPD now are already wearing sunscreen before I tell them to, and I don't have to introduce them to the idea of sunscreen, and I think that's great. That's a huge shift that I'm seeing in the last, I'd say, 5 years. Post-pandemic.
Yeah.
The sunscreen usage has massively increased.
I think skincare in general people have been more aware post-pandemic. There's just so much information out there. teenagers are aware of AHA, BHA. हमने कभी सुना भी नहीं,
I know.
right? When I was a teenager, I think I had just heard of moisturizer, and I grew up in Delhi, so वो winters में लगता था, right? So moisturizer, and I'd heard of sunscreen also because Mama is a dermatologist, and that time now while talking to you, मुझे मम्मा की बातें याद आई कि अपनी ये लगा लेना तो मुझे बाद में thank you बोलेगा. Like she used to tell me that. But back in the days, so 15-20 years back, sunscreens were also so chip-chipa that I developed an aversion to it. So throughout my MBBS, I mustn't have ever used a single day would have gone with me using sunscreen. When I entered MD, जब skin में घुसा पड़ने लगा, लगाना चाहिए. And actually, I think I was skewed towards using sunscreen in my MD when I got my first free sample.
Correct. Same thing happened to me.
Sample
So
मिला
my
था.
parents were dermats. My parents were gynacs, of course. Such like medical fraternities are very like weird. We don't seem to take any other careers, but irrespective. So my parents never used sunscreens and they never asked me to. And I remember we used to go to Goa a lot as kids. My parents loved Goa. So at least twice a year we'd go to Goa and we'd be out on the beach and I would come back 10 shades darker.
Yeah.
I kid you not. I used to be black. And all the photos from my childhood when I see them now, and I'm like, there's no like lighter skin supremacy or anything I'm talking about here, absolutely. But my shade was completely different. Like I looked like a different person back then.
Yeah.
And the only thing that's changed is I think my MD only, I started using sunscreen for the first time. And that's the amount of difference. And no other skincare, frankly, till PG got over, all I did was sunscreen, nothing else. We didn't get any other samples. Even for those sunscreen samples, we would fight over. So literally no other skincare, and just that much difference. And that makes me believe, Kajol had come up and she'd spoken about, people talked about her doing stuff to lighten her skin. And she'd said it was just sunscreen use. And I totally believe it. I actually do believe it because it can make that much of a difference. Actresses back then, they had outdoor shoots. They didn't have vanity vans. They used to sit under like one umbrella. Massive amounts of sun exposure. I'm sure they also barely knew about sunscreens back then.
Yeah.
So I can believe the extent of that difference in skin.
Yeah, because I used to swim in school when I was in school. And our swimming used to happen immediately post school. So 3:30 p.m. I remember our swimming class would start. So 3:30 p.m. broad sunlight में. And yes, if you see the color of my shoes, that was that was how tanned I had become. And you wouldn't be able to recognize me.
Yeah.
But with age, all that tan.
And zero regrets. Like I love.
Oh, I loved it. I loved my tan. I loved my. You know what I realized? With darker skin, with tan skin, your muscles look better.
See, also we had muscles back then.
I don't know. Muscles.
So I was a gymnast. So I could do like these. I could do pull-ups. I could do 30 pull-ups. I could do like 175 crunches. I was insane back then. Yeah. So like I don't know if it was a tan or actual muscles. Now there's just flab everywhere. So
I had 6 packs back in the day. Now I have a family pack. But
love it.
I blame my lack of tan कि मेरे muscles
that's why.
मेरा tan चला गया ना इसके लिए मेरे muscles नहीं दिख रहे.
थोड़ा sunbathing चाहिए life में. That'll fix it. Okay. Now tell me, what do you think? Is men's skin seriously different from women's skin anatomically? Other than the facts that you mentioned about the porosity, how people keep talking about it's thicker, rougher.
So anatomically, and the rougher would be just because if you shave, that's the stubble. No, but in terms of the oiliness, the oily content wise, yes, men's skin is oilier. I'm just using very simple words. More seborrheic activity. Other than that, we are not subject to the cyclical ups and downs of hormones.
Yes.
So that way, we don't get cyclical breakouts. Premenstrual breakouts, 1-2 pimples here and there is absolutely normal. That men's skin also over the in middle ages also melasma, pigmentary disorders tend to affect women more. But when it affects men, it's really bad because it's very resistant. It's much easier to treat pigmentary disorders in women, but men में थोड़ा resistance रहता है. But yes, by and large, yes, skin is gender neutral. There are just slight variations. For example, each organ of ours is gender neutral. but just slight variation. So, for example, my liver will be slightly bigger than yours. My skeleton, from my skeleton, you can determine that this is a male skeleton, yours is a female skeleton. वो सब थोड़ा बहुत 19-20 का फर्क रहता है.
Differences in body fat,
उतना biologically वो सब, but by and large,
it's not that significant.
It's not that significant. Why I'm saying, because when it comes to treating men's skin versus women's skin, the products are the same. The pharmaceutical grade products that we use or any over the counter product that we use वो same ही रहेगा. So skin care is gender neutral, even though there might be slight variations in our skin. So for example, men and women's skeletons are different, but exercises तो same ही है जो हम जिम में जाके करेंगे, right? उसमें फर्क नहीं पड़ता.
Oh, that's a great way to put it.
Exactly, right? So that's the only difference. So the way we treat it, or your approach to treating it, is more or less the same.
Can you suggest a basic skincare routine for any guy who wants to get started with skincare? Very basic. And this is, of course, a very general thing, not based on skincare.
Fair enough. So if you didn't have to use anything, like the most basic routine would be just wash your face. Now, in case you're very blessed, where your soap that you use for the body, उसी से आपका चेहरा भी धुल जाता है, and it is not drying out your facial skin that much, or leading out to breakouts, maybe तुम अपना body wash से face wash कर लो. So one cleansing agent, whatever that is, moisturizer, and I usually say swad anusar, okay? Which means I have very oily skin and I live in a tropical climate, right? I don't usually use a moisturizer, but even though when I have oily skin, but I shift to a drier city when the humidity is low, I need to use a moisturizer. ठीक है, वो मैं gel based use करता हूँ, अलग बात है. But by and large, where I live, I don't use moisturizer. I don't remember the last time I did, because I still can get away with it. Okay, so moisturizer I would incorporate as स्वाद अनुसार, and yes, dermatologist हूँ, शगुन के लिए बोलना ही है, sunscreen, because yes, we are all Indian, we are brown, which means we have more melanin, no doubt about it. We are blessed where we are almost semi-immune to skin cancers, melanomas. We are blessed where we don't get that sunburnt. But if you want to prevent sun aging, if you want to prevent sun damage, the most basic intervention which will help you is a sunscreen. So that's about it. One cleansing thing, moisturizer swad anusar, and a sunscreen. So these are just guidelines. You don't have, one size does not fit all, which is why just because I've said it doesn't mean कि तुम लगाओ. You know what I mean? It's
and of course everything is going to depend on what kind of skin issues you have. And men in general, I feel acne is extremely common. Seborrheic dermatitis, dandruff is extremely common, not just on the scalp,
beard.
But even on the beard area. It often worsens when you have active acne in the beard area, possibly sometimes related to the seborrheic, and men keep shaving over it. So I keep telling people that when you have active acne, when you have active seborrheic, maybe use a trimmer. Don't shave. That's going to worsen these things. What shaving tips would you recommend for people?
So now, if you're somebody who keeps a beard, I keep a beard. You can't shave directly. So first, if I have to ever be clean shaven, I have to first use a trimmer. Trim at say about 0.5, 0.3 और trim करो, फिर 0 power पे जाके trim करो, then I can only use a blade. Because if I directly use a blade on such thick beard, I'll have to take multiple passes, which will end up causing more trauma, more injury. I might end up getting some cuts. Secondly, the only thing I'll say is respect the direction of hair growth. And I've said this multiple times, I'll say this again. Zoom in on my cat face. My hair grows from top to bottom like this, which means if I have to shave, I will shave like this. But in this part, my hair grows from top to bottom here, but bottom to top in this part, which means if I have to shave, I have to shave like this and like this. If I shave like this throughout, then in this part, I'll be opposite the direction of hair growth, and I'll end up getting pseudofolliculitis or ingrown hair. So that's the only thing that I'm going to say. Respect the direction of hair growth, and please change your blade. If you see there's any sign of rust, or if the blade thoda blunt ho gaya, after 6-7 shaves blunt ho hi jata hai, please change it. Jindagi mat karo, just change it.
I love that you have a demo on your own face to show multiple directions. It's very hard for me to explain this to Okay.
Good, no? Your laser hair reduction is working.
Yeah. I mean, not that I had that much, okay, to start with.
It's okay.
What about hair fall? So hair fall is something that a lot of men face.
Yeah.
Very often, we blame. I see patients coming and telling me that it's the water. I moved to the city and the hard water is causing it. But 99% of the times, yes, I mean, water could worsen it. Your stress levels could worsen it. What you eat could worsen it, and it could really, really worsen it. But a lot of the times, it's just a male pattern hair loss, which is androgenetic alopecia. And what tips would you give to people with?
So one thing is, please, if you have your father, your mama, your chacha, your dada, your nana, if anyone in your family has history of baldness, please note कि तुम्हारा number भी आएगा, ठीक है? So while you have 18-20 years before androgenetic alopecia usually starts, right? If it's very aggressive, if you're very unlucky, college में घुसोगे and you're already sitting at a stage 2, stage 3, right? But while growing up, if you have noticed your elders in your house, your blood relatives, and if they have androgenetic alopecia, please have a very low threshold for going to a dermatologist because तुम्हारा number आएगा ही आएगा. There is no running away from it. Because when we intervene early, we can almost reverse it to near total. मतलब किसी को पता नहीं लगेगा. So I have a family history of androgenetic alopecia. I have androgenetic alopecia, right?
It doesn't look like it.
Thank you.
Being a dermat helps.
Yeah, because I don't think you would trust me very well if I was bald and if I was a dermatologist.
This is a big issue, though.
Yeah.
Like,
Imagine cardiologist who gets heart attacks.
बहुत होता है. This happens a lot. Like a dermatologist who gets acne. Happens a lot.
Yeah, happens a lot.
It's the same
Fair
thing.
enough, fair enough.
There was a very senior dermatologist in a conference, I don't want to take names, who's completely bald. Okay, he's completely lost his hair. But a great dermatologist. You know what he said to patients who would judge him for his lack of hair? He would say that you're lucky you got a dermat soon. I didn't get one. I was like, that makes sense.
Makes sense. Yeah. So my AGA started kicking in when I was, I think, in my second or third year of MD. So luckily I managed mine with topicals.
Yeah.
बीच में I had taken a course of oral medication also, but मेरा topical से काम बन जाता है.
Right.
But my family history is very strong from my mother's side, so I have to.
Absolutely. And what you said is really important that we need to start early. I see a lot of men come in at a very late stage when your scalp visibility is very, very high.
Yeah.
With a very high grade of alopecia. And at that point, they tell me, मुझे transplant नहीं करना है. And, I don't want to even take oral medications. I don't want to do PRP. I don't want to do anything. And I just want you to give me a serum and I want it to grow hair. It'll grow a little bit, but it's not going to be enough to cover your entire scalp at that stage. So it's very important to start early and to respect the fact that, hey, this is going to be a lifelong issue. It's not going to be something that, it's not a post-COVID hair fall जो 6 महीने में जा रहा है. This is going to be with you for a while.
तो अगर फैमिली में कोई है bald, please फटाक से जाओ डॉक्टर के पास, तुम्हारा नंबर आएगा.
Correct. Okay, another myth a lot of men have is that if your soap or your face wash tingles, that means it works. What do you think of that?
So slight tingling which settles on its own and over a couple of days is fine. हो सकता है. But after repeated use, अगर tingling हो रहा है, if you're getting any redness, burning, dryness, irritation, no, then that product is definitely too strong for you. It is not suiting you. So
I particularly feel about these men's face washes that are marketed nowadays.
Okay.
They are far too harsh. Like they strip your barrier. Again, I don't want to take any names here, but they strip your barrier. They just leave your face. Like I feel after you wash your face, it's not meant to feel squeaky clean. It shouldn't feel tight and dry.
Yes.
And I think that's what these men's products are being marketed as.
Yeah.
And that's what men think that a face wash is supposed to do.
No, but that's not just like a lot of people, even for the soap that that they use for bathing, they feel that नहाने के बाद skin थोड़ा dry लगना चाहिए, which means that अभी मस्त नहा लिया, They feel
I am clean only if every lipid is stripped from my
Exactly, right? So a lot of men also the way a lot of men wash their face, right? I'm just going to push this back a bit. You would have seen, so that is very vigorous rubbing also. And yes, like you correctly said, a lot of men's face washes are very strong and they literally strip away all the protective lipids. That is a problem. So after any product, and this is a blanket statement that I'm making, if you experience prolonged, sustained redness, burning, dryness, irritation, then that product is too strong for you. Itna bhi strong face wash nahi karna. The purpose of a cleanser is literally just to wash your face. Don't expect any magic with it. So as long as dhul mitti nikal gayi, the dirt, the dust, the grime, the pollution, that's good enough.
Okay, I'm going to move on to a slightly more fun round now. Okay,
This wasn't fun till now.
Who does more skincare, you or your wife? I thought it
Yeah.
was. That's obviously a dumb thing. What's the ickiest thing that men do to their skin?
Men, specifically men.
Specifically men. That really triggers you.
So they have one trimmer. They use that to trim their genitals, and then next day they're trimming their face with it. So
yeah, that is kind of.
And they don't clean the trimmer. So if you sterilize the trimmer, that's great. But
probably not happening. One alternate profession you would have chosen if not dermatology?
Oh, I was actually all set to become go to MIT and do quantum mechanics, quantum physics.
Oh, wow.
I chose medicine because my then girlfriend, she made me watch Grey's Anatomy.
Wow, that's the weirdest career story I've ever heard.
Yeah. I had taken PCMB, okay, until 12th, and until I think class 12, mid class 12, I had not even joined any coaching institute, nothing like that, because my pura SAT deke, I was all set ki jaunga, US में जाऊंगा, सब होगा, quantum mechanics करूंगा, and I don't know why I got swayed. My life would be as glamorous as Grey's Anatomy, and I thought MBBS में like the way they show हर एक room में कुछ हो रहा है. I was like मेरा life ऐसा ही होगा. On-call nights are going to be fun.
And then you joined MBBS.
Then I joined.
And all your dreams came crashing down.
Yeah, everything.
Happens to the best of us.
Yeah.
What's the weirdest thing that's happened to you on social media?
Weirdest thing. A lot of men have proposed to me, and they have very explicitly desired to have children with me. Yes, so I've received a lot
That's
of.
flattering.
Men flatter a lot, huh? When somebody wants to hit on you, they flatter a lot. But even
I have a lot of gay friends, and I can tell you this: their choice in men is better than the choice that women have in men.
Fair. No, I just mean that when.
So you should be flattered.
I am very flattered, and I just don't know how to say no.
Yeah.
So
without breaking their heart.
Yeah, so I just don't reply to those messages. बुरा लग जाएगा.
Agni's in demand.
No, but they're very sweet, very sweet. They'll comment on everything. They'll send me such nice messages. But I mean, they know I'm with Meher and everything. But they desire to have children with me. So okay, let's keep it like that.
Lovely. I know you're a big Potterhead. Can you name the one condition that you think Lord Voldemort could have had which led to his appearance?
Alopecia universalis.
Yeah, that too.
He has no hair, right?
And the nose? What could explain the nose?
The serpent, the slits for nostrils could be maybe he had a very porphyria cutaneous tarda, because there is
I actually didn't think of that too. Or leprosy.
Or Hansen's, but yeah, because उसमें तो resorption हो जाता है ना. Or if I have to show you that maybe अच्छे से करें, so even in vaginous granulomatosis there is
very nice.
there is resorption of the nasal
Agni has studied.
But PCT
very
would be
nice.
better with because autoimmune है, and with अपना alopecia universalis.
What's the most underrated skincare treatment that you can think of?
Underrated. I think the good old fashioned microneedling with platelet-rich plasma, because nowadays we have better microneedlings. We have microneedling with RF. So जो plain microneedling हम इतना नहीं कर रहे.
Yeah. But that worked pretty well too.
It was working pretty well. I mean, microneedling with PRP, if say budget is on the lower side, because if RF becomes expensive, then I would just. It's a good one. Yeah, I like it.
What skincare trend do you wish would disappear?
Trend. I don't consume a lot of it, but I believe there is something about putting period blood on your face. Is that something which there is?
Yeah, it's a little horrifying.
Yeah, there
is. I don't know what makes people think of things like this. But it doesn't work. And there is no way logically, humanly that this could work.
और एक दो मैंने देखा था period blood है फिर
semen facials.
Who semen?
I mean, salmon sperm DNA facials would work.
That is polydeoxy, that's PDR. No?
Yeah. Human semen facials will not work on acne. I have watched a trend like that. Something you tell your patients not to do, but you secretly do.
Oh, I tell them never to fiddle with a pimple. and never to touch the face when they get a pimple, because it's a human tendency
I know.
to agar aaya to, so sometimes,
This is mine.
Huh.
Can you see this mark here? This is the one I filled with.
so
It's just not
when you
okay.
get it, sometimes you feel ki nahi, this might just be an open comedone, to nikal jayega.
Yeah.
So yeah, I fiddle with my comedones if and when I do get them, even though I tell my patients, so do what I say, not what I do.
Love it.
Hmm.
Any final tips for the guys out here?
Doing skincare or taking care of your skin will not make you any less manly. Doing skincare is not feminine, it's not masculine, it is just a human thing. Look after your skin the same way you would look after your heart, your kidneys, your livers, your joints. I know you will invest into good sports equipment. I know you will invest probably in a good gym membership. Um, because conventionally that has been regarded as masculine. I want you to know that looking after your skin, I look at my muscles the same way I look at my skin, and the same way I look at my liver. They're for me, they're all the same. So that's about it.
That's nice. That's a really nice way to put it. Thank you, Agni. Thanks for being here, and thanks
Thank
for
you.
all the inappropriate jokes in the middle of this podcast. You
Mere
really
no.
livened it up and added color to this podcast.
Thank you.
Thank you so much.
Thank you so much.
For all those of you watching, thank you for watching. I hope you liked it. If you liked it, do let us know. If you have any questions, all of you guys out there about skincare, you can ask us in the comments or you can DM us, and we'll be really happy to answer all of your questions. If you like this podcast, please do subscribe, and we'll be sharing more such interesting episodes very soon. Thank you.